been taking care of very sick COVID people that really should be in the ICU. We're asked to work out of our scope, things that we're not trained to do, we're doing because of the short staffing.
Supply shortages, running out of certain vents and breathing apparatus.
We have lost about 110 nurses from this facility since March because the working conditions are just so untenable. Patients, unfortunately, were left lying in their own urine, in feces, unable to get out of bed. There's nobody there to hold their hand and guide them through this process to let them know that they're going to be okay. These nurses want to be able to provide timely, appropriate care, and they can't do it. This corporation, Tenet Healthcare, has been given over $1.2 billion from the federal government since the beginning of this pandemic to make sure that they were not going to suffer any great financial loss that would interfere with them being able to provide care.
A lot of people have left because the contract's not negotiated. A lot of people left because there's better offers someplace else. A lot of people left because it's just not safe for them to be working like this with COVID patients with the PPE situation that we had earlier in the spring. This is probably the most traumatic experience we'll have as nurses. We don't know that if we could do something more than what we're doing now.
While we had a decrease in the numbers over the summer especially, we tried to engage them in conversation about what we would do when the next surge came, and we were met with just silence. So we could have been much better prepared than we are now.
We love our jobs and we love what we do and we love the people we work with, but we can't keep doing it like this.
We have been saying the same thing for over 2 years now about the unsafe staffing in this building. It was unsafe then. It is frighteningly perilous at this point. It's not about just the money that we receive, an hourly rate. We want to be able to take good care of people, be proud of what we're doing, and get them home and out of this facility intact. And we can only do that if we have enough nurses at the bedside.